You can turn subtitles on by clicking this symbol in the bottom right corner. By clicking the cog next to this, you can also adjust the playback speed to make the speech whatever speed you feel comfortable listening to.
Hello and welcome to the breast screening service. I'm Natalie. I'm a trainee consultant nurse at the Beds and Hearts breast screening unit. If you are registered to a GP practice, you will be invited for a breast screening every 3 years, between the ages of 50 and up to your 71st birthday. You may also hear screening called a mammogram. You are able to request a mammogram if you are over the age of 71 by calling our centre. We would like to take this opportunity to show you around one of our breast screening vans. This is our new screening van. This van is in Luton, but we have vans placed across the country. You will usually be invited to your nearest breast screening van. Each of our vans is fitted with a lift. The lift goes flat to the floor and raises up to the van entrance level. As you can see, this van is bright, airy and spacious. Some vans are fitted with air conditioning too. Some of our vans have lights that can be dimmed and others have lights that can be turned off. So if it's too bright for you, you can always ask a member of staff to turn off the lights. Our breast screening vans are not fitted with toilets. However, we are always in a location where there is a toilet in close proximity. This would either be in a supermarket or a shop. On arrival at the van, you will be greeted by a female member of staff who will check your details. They will ask questions such as your name, your address and your contact details. There is a small seating area where you can sit until your appointment time. Remember not to arrive too early as the space is limited. You can come along with a friend, partner, family member or carer. If it's too busy, we may ask them to wait outside the van. But if you need additional support, then they are welcome to stay. For the mammogram, you'll need to undress so you are naked from the waist up. We have 2 changing cubicles in the van for your privacy. It is best to wear a top and skirt or top and trousers to the appointment rather than a dress. You will also need to remove any necklaces you wear before you arrive for your appointment. On the day of the appointment, do not use talcum powder or spray deodorant as this can affect the mammogram, but roll-on deodorant is absolutely fine. Here is the mammogram machine. We have one on each van. The mammogram takes x-rays of the breast tissue to check it is healthy. The person who operates the mammogram machine is called a mammographer. The mammographer is specially trained to position your breast in the mammogram machine. We take 2 pictures of each breast, a side-to-side view and a top-to-bottom view. This is to ensure we have a good view of all the breast tissue. The mammographer or assistant practitioner are specially trained to take these images and are here to support you through your screening appointment. Please talk to us if you are worried or concerned about having your mammogram. The mammogram only takes a few minutes in total. We'd like to take this opportunity to show you the mammogram machine, some of the noises it makes and the different positions that are required to do the 2 views of each breast. Firstly, we'd like to show you the compression that is required to take a clear x-ray of the breast. If the speed at which the compression comes down is too much for you and too fast, we can take it down a small amount and then manually adjust at a much slower pace. In order to get a clear x-ray, we do need to compress the breast for a few seconds. This can be uncomfortable for some women, but most find it absolutely okay. If it does feel uncomfortable, you can let the mammographer know and they can release the pressure until you are ready to continue. Breasts come in all different shapes and sizes, so whatever shape and size you are, we can accommodate your breast screen. We can change the paddles on the mammogram machine to accommodate your breast shape and size in order to get a good, clear image. In order to do the side-to-side views of the breast, we need to move the machine, and we'd like to demonstrate that to you now so you know what to expect. We can also take mammograms in the seated position, so if you did come in a wheelchair, we would be able to move the whole machine down to accommodate the level at which you are sitting, and Jo will demonstrate this to you now. If you use a motorised wheelchair, it would be more suitable for you to be screened at one of our units. Please call us to discuss this further. Once Jo has positioned you in the mammogram machine, she will stand behind the screen just for a few seconds whilst the image is being taken and then come back to you for the second picture. If you need to have a break or a pause in between your mammogram images, there is a chair in the room for you to do so if you need to. Once your images are taken, they are sent to our centre where they are looked at by 2 specially trained film readers. You will receive your results by post within 2 to 3 weeks. Sometimes you may need a second appointment. The majority of women who attend for breast screening receive a normal result. If we do notice any changes on your mammogram or we need to look at an area further, we will call you back to our assessment clinic. You'll receive a letter by post inviting you for this. Breast screening saves lives. The mammogram can detect small changes in the breast before you have any signs or symptoms. It is important to attend your breast screening appointment when you are invited. Remember to check your breasts in between your screens and report any changes to your GP. We are here to support you, so please speak to us if you have any worries or concerns regarding your breast screening. Contact details of your local breast screening service can be found on the NHS website.